Let's continue to bring you reaction to South African Health Products Authority's approval for a second dose of booster shots of the Johnson & Johnson COVID-19 vaccine for individuals over 18. As we mentioned earlier, the booster shot will be available from tomorrow, while the Pfizer booster shot will be rolled out from the 28th. Joining us now is Progressive Health Forum convener, Dr. Aslam Dasoo. A very good afternoon to you, and thank you very much for joining us. So welcome, Move.
Very much so. Good afternoon to you too. Certainly a very welcome move. It couldn't have been more timely, given that we are in the midst of another surge, and we do have fairly low rates of vaccination. But more than that, we do know that people who've had vaccines, 6 months, 8 months, 9 months ago, are demonstrating decreasing immunity, as Omicron is demonstrating to us. And so this is most timely and very welcome that people will be able to get it from tomorrow. SAHPRA's approval has just been received, and the department has moved with alacrity on this, and they need to be commended for that.
I'd like us to expand on an issue that you raised, which is the low rates of vaccination. As we progress with this tomorrow, there's a number of people who are still left behind out of choice in South Africa. I think it's safe to say that government has communicated effectively where this is concerned. But from the work that you do and from, what you perceive, needs to be done to get people on board with this.
Okay, yes, I agree. I think there's a fairly large degree of vaccine hesitancy. And what is interesting about this, as research has shown, is that it's a minority of those who are completely set against any vaccination. That the majority, in fact, would take it if they knew more about it. And that comes to your point around communication. Look, we have had a very corporatized communication around this. And unfortunately, people's facility with biology is not always up to scratch. And I don't think that the message has penetrated as far as it could have. What does need to happen is the enlistment of local trusted leadership, community leadership, your local teachers, nurses, traditional healers, so on, to communicate the benefits of vaccination in the idiom to which that community is accustomed. That way you bring the vaccine, the knowledge of it, and the vaccine itself to the people. I think this is going to be a very necessary endeavor as we move into the new year, and I hope that the communication specialists are alive to this particular issue.
Dr. Dasoo, then in comes this dynamic, right? So a country like Nigeria, for instance, making known that they will no longer be receiving vaccinations with short expiry dates. They've also had to get rid of some 1 million vaccines. A country like Malawi as well, talking about burning some 200,000 vaccines. So with the issue of, expiry dates of vaccines, what do you perceive, or what kind of strategies can some countries on the continent adopt? I ask you that because the World Health Organization has made it known that the continent receives some 20 million vaccines a week. I think that figure probably has changed this week, but that was as of last week.
Yes, I think it's a very unfortunate situation, and I think it's a casualty of the frenetic activity around getting, vaccines distributed as far and wide as possible. The issue of the short expiry dates is a real problem, and I can understand Nigeria's issue, receiving 2 million doses, 1 million of which was on such a short expiry date that they couldn't have delivered it in time or administered it in time. There is a sense that these expiry dates are the original expiry dates of the vaccines as manufactured, and they're more a storage date rather than an expiry date, but I'm not sure that that's the case here. We have to go by what people have said. Now, the fact that we might be getting increased supply, if that means a constrained ability to administer, then you're going to have more of this problem. So clearly a streamlining needs to happen. In South Africa, for example, we have, I believe, about 15 million doses in stock. But when the uptake dropped, the government decided not to order more dosages until we use these up, and presumably these have a sufficient expiry interval. But the problem is that if we do use them up and we do need more vaccine, then we will have cancelled orders and then fall back to the back of the queue. So this is a very difficult juggling act. I do think, however, that it's a victim really of the very, as I mentioned, frenetic activity around the distribution of vaccines. We need to get a better handle on this. Countries need to get a better handle on this. As a mitigation to this, countries with excess stock, which may be expiring soon, should feel no compunction in giving it to countries that are short of vaccines. This would be an appropriate thing. Certainly in our region, this would be a show of great regional solidarity, as well as getting more people in the region vaccinated. Because really we have to think as a region, not just within our own borders, which the virus does not respect at all. And we should, do what we can to get this going. I think tomorrow's startup of the boosters may start seeing the uptake of vaccination, increase again, which will be most welcome. And then we have to watch our stocks accordingly.
Progressive Health Forum convener, Dr. Aslam Dasoo, always a pleasure. Thank you.